Well, welcome everyone to this webinar on working with young people with complex mental health issues, particularly really thinking about an adolescent intervention as applied to a specific case. We'd like in particular to acknowledge the Department of Education, New South Wales School Link, and also the New South Wales Department of Health for supporting this webinar. I'll just give you a bit of an overview of what we're going to do. So firstly, I'm Brittany and I'm the Director of the Project AIR strategy. We have been supported to do this work and we're really pleased to bring this webinar to you. So the case study of Brittany is one that you will have got in advance of this webinar, and it will be available afterwards if you're watching this webinar pre-recorded. We will have a panel that will present each perspective on the case. We will have a short question and answer to give you some opportunity to ask us some questions and for us to really open up the whole issue about working with young people. And then we'll finish. We should be planning to finish about in an hour and 15 minutes. Everything that is really based on the work from Project AIR strategy. And if you know or interested in following up further work on the Project AIR strategy, we would encourage you to go to our website. So that's https www.projectairstrategy.org, where you'll find a lot of information and also manuals and supports for this webinar. There's also on there the Adolescent Intervention Guide for Clinicians. It's a resource for you to freely use. We've developed it with the support of Department of Education and Department of Health. You'll see that there's a lot in there, and today's webinar really supports one of the case studies that's in that Adolescent Intervention, which is really the case study of Brittany. But in the Adolescent Intervention, you'll see that there are some principles for working with young people, issues around working with complexity, how to think about the case in terms of reflective practice, how to engage young people, how to manage risk, some tips and strategies for intervention, and also some of the really complex issues that can happen within a school environment or in the community, around things like self-harm, social contagion, online considerations, and really how to work and collaborate with the school around making sure young people with complex mental health, as much as possible, can stay well engaged at school. And sometimes that really does involve working with the families as well. So a few acknowledgements. Firstly, we have a steering committee who have been very helpful for us. We've had peer reviewers in health, in education, and we've also had an intervention development team and also people with lived experience. And I'd really like just to acknowledge them as well. But also people from Aboriginal and Torres Strait Islander background, and just to pay my respects to Aboriginal people past and present who have really contributed to this work, who form the basis of, I suppose, a lot of the work on the ground in local communities, and that acknowledge that this webinar is also being broadcast widely. And there may even be people from overseas in different countries watching this. So just to acknowledge our own traditional owners of the land here in Australia. So we have a good panel for you, experienced clinicians. We have John Dean, Esther Crowell and Heidi Page. I'm going to just say a few words just to introduce our panel. So John Dean is a registered psychologist with the Murrumbidgee Local Health District who has a long experience in child and adolescent mental health services as a clinician and community mental health, drug and alcohol. And he's managed services and also worked with them. He's currently in Wagga Wagga as the District Clinical Leader for School Link and the Got It program. Heidi Page is our second speaker, a registered psychologist, this time based in the Illawarra, Fellhaven. She has over 20 years experience in public education as both a teacher and a school counsellor. And in her current school setting, Heidi works frequently with young people who present with complex mental health conditions. And our final speaker, Esther Crow, is a psychologist. She's been working at the Child and Adolescent Youth Mental Health Service for several years. In that role encompasses assessing and working therapeutic with children and adolescents with significant mental health difficulties. She has an interest in attachment, trauma, and reparative parenting, and works hard to include families and supports in every treatment modality for every condition. The background of this presentation and the thinking is around the case of Brittany. So as you know, from reading the preparation work, Brittany is a 16-year-old female in year 11. She's currently returning to school after a recent incident of inpatient admission following a suicide attempt. And while in hospital, Brittany was diagnosed with borderline personality disorder, and upon discharge was referred to the local community mental health service for ongoing support. In the months before her suicide attempt, she moved out of the family home into supported medium-term accommodation and child protection services, and they were involved and had a number of other supports. Since Brittany's admission, the school link coordinator has been putting together the various professionals to support effective collaboration for Brittany, and we're now already working on her return to school. That's the background of the case. Here is, I suppose, some of the background. We are trying to help her in the return to school from this incident. She has in her background witnessed parental domestic violence and family breakdown. Her mother has also got BPD and is involved but intrusive. There has been instances of self-harming in school and real difficulties with her school peers. She alternates between intense relationships, then breakups, social media conflicts, and face-to-face arguments. The school counsellor has developed a safety plan. There's a community mental health providing ongoing support, and the school link coordinator is fostering collaboration. So we'll now watch the video of Brittany.
After I came out of hospital and went back to school, I just felt like everyone was just judging me. They pretend that they're not, and they try and be supportive, but they don't actually care. And the teachers they would pretend to be supportive and ask me how I was and things like that, but they don't actually care. They don't know what I've gone through, and they don't actually care if I'm okay. It's just their job to ask me things like that. And I could just tell that everyone was just judging me. And I just when I got back, I just found it so much more difficult to talk to people, and all my friends were just judging me, and I just felt so stupid, and it was just really embarrassing, and yeah. So Mum took my phone because she thinks I'm spending too much time on social media, which is stupid. School is so stupid at the moment, and if Mum's treating me like this as well, it just feels like everyone is against me, and it's just so frustrating. And I had this meeting with the school counsellor today, which was so bad. I just find myself pushing people away all the time because that's just easier for me. And it's it's easier, but then also I'm just left with no one. So I don't know. And everyone else seems to be able to connect with people really easily, and I see people just on the street or at school just talking to people, and I just don't get it. It's just for me it's so much easier just not to deal with that and just to push them away. And and like just be with like myself, I guess. I just feel like so isolated and no one really understands like what I'm going through at all. But like I kind of just wish there was like somebody that just like got me, or like would actually understand like everything that's going on, and like actually just like I like cared, and like somebody that I could just connect with. It's like anyone that just like understood even like a little bit like how I was feeling.
See from the video of Brittany that she's really struggling, and really struggling with the idea of connecting with people, of getting back to school, of feeling like a lot of people are judging her, and really feeling really quite isolated and really wanting somebody to understand. So this is really a big opportunity for us to think about what can we put in place for Brittany that's going to be helpful. So I'd like to invite you, John, as the schooling coordinator, to give us a sense of what you think a schooling coordinator would be thinking about in relationship to Brittany and more broadly.
Thank you, Bryn. I think firstly I need to point out that the School Link role exists across New South Wales. However, it does vary a little from local health district to local health district in how it actually operates. So I'm going to tell you how I would approach it from the School Link role in Murrumbidgee Local Health District. And that's really to make sure that all those working with Brittany are working together collaboratively towards Brittany's goals. So Brittany's mental health needs, her education needs, her independent living needs, they could be seen as competing priorities, I suppose, but in fact, they're all important. And if Brittany feels like she's coping in those various environments, she'll be able to engage in school and with any care and support services available. Thanks, Bryn. So moving on, one of the roles the schooling coordinator has is to bring together information to inform any planning processes that might be going on. So not necessarily facilitating, but overseeing the process and making sure that all who might be involved are included, and clarifying pathways to and from acute care, including the hospital setting. So making sure that the supports are there as Brittany comes from hospital into back to school, and also back into the community and into her living situation. Thanks, Bryn. So the complex care review, and Esther and Heidi will talk more about this, but it's important that we improve the outcomes of a young person such as Brittany through identifying with her particular goals, and really the schooling coordinator can help to improve the knowledge and awareness of complex mental health issues for those at the table and how we might approach these. We can also talk about the needs of staff, say at school, and how the schooling coordinator might be able to contribute to help develop the knowledge and skills around and the capacity to deal with the sorts of issues that might come up, so that staff feel more confident in what they're doing. Have particular focus on the sorts of areas that are identified in the guidelines, such as managing risk, making sure a safety plan's in place, making sure that there's the clinical care that's necessary and that there's good relationships with those who are providing that, including the family if that's appropriate, and trying to mend some of the bridges, I suppose, with family if that's relevant. We know that school connectedness has an impact on a young person's well-being. Thanks, Bryn. So to the point where, there's evidence that suggests that positive school experiences can support recovery for young people with complex mental health issues and improve their academic outcome. So we can be inclined to say at these times that perhaps school doesn't matter because this young person is really struggling, but in fact, getting back in and getting involved and feeling confident in the school environment can be a great help. Thank you very much.
Strategies there, in particular the complex care review to get everyone on the same page is really wonderful, John. Esther, what's your perspective on Brittany? Esther?
Thanks for that, Bryn. So in a complex case like Brittany's, I would want to draw attention to reflective practice as a really crucial element to engage in. It's going to be important to explore our own reactions to Brittany in order to avoid anxiety and threat activation responses leading to knee-jerk, shallow conceptualizations of Brittany's presentation. As many of you may be aware, high levels of arousal and anxiety don't tend to lend themselves well to complex thought. And sometimes we forget that it's not just our clients who are susceptible to these reactions. Professionals experiencing these emotions could fall into the trap of focusing too exclusively on the immediate problematic behaviours or symptoms without giving due consideration to the full range of biopsychosocial factors at play in Brittany's life. And this could also cause them to overlook Brittany's own goals and priorities. Another key feature of Brittany's presentation that I would want to draw attention to is the role of secure adult attachment figures in her life. It seems like Brittany has very few secure attachment figures in her life and no reparative parenting relationships. I would want to explore if she has any extended family members who, while perhaps being unable to house her, might still be willing to play a role in her therapy or supporting her academically by taking an interest in her schooling. We need to be careful not to make assumptions about young people who are living in out-of-home care, that we don't assume that there are no caregivers in their life who we could involve. I would strongly recommend asking Brittany directly if there's anybody in her life that she would like to have involved in her care planning. This could be somebody in the community, but it might also be somebody from the school, such as a teacher who she has a trusting relationship with. I would really want to empower her to work with the team and have a say in her care planning and treatment, rather than have her left feeling like she's being worked on. This is especially important given her many experiences of being unable to control her environment, from early DV to her recent removal from care. These experiences may have left her feeling powerless, hopeless, and anxious. We'd want to do all that we could to empower her to be an active consumer within her support network. While parts of her cognitive functioning could be delayed due to her trauma history, again, we want to empower her as much as possible to act as a mature adolescent by giving her choices and agency. Her agency and engagement is particularly important when looking at the development of safety plans. We really don't want this document to become a routine tick box exercise. We want it to be a living document that Brittany can use to educate and inform those around her of what she needs in times of crisis and how they can recognise such a crisis. We want her to feel like she owns this document, she knows what's in it, and she agrees with it. It'd be really important in safety planning that we collect details of her past suicide attempts. We need to be sensitive, but not shy when it comes to directly asking her about the past attempt what the lead up was it, what the methods used were, how she came to get help afterwards, how she felt about the help that was provided, and if this could have been handled better or was traumatic in any way, and very importantly, how she feels about still being alive. So key points to take note of in such an assessment would be the lethality of her method, any help-seeking behaviour after the attempt, and whether being alive has left her feeling glad, ambivalent, or unhappy. We'd also want to establish how impulsive versus planned this attempt was, as that gives us really important information about the extent to which impulsivity might act as a risk factor for Brittany in the future and could lead to rapid changes in her risk level. Another important consideration in risk assessment and management is, of course, self-harm. So just like assessing suicidality, a sensitive, non-judgmental but direct approach would be appropriate in asking Brittany about her self-harm. We'd want to explore the method she used, her level of awareness of the risks for infection and accidental death, and we'd want to look at the context in which the self-harm is occurring. We'd need to manage both the self-harm risk and the risk to the other students experiencing social contagion due to witnessing Brittany's behaviour. We'd want to explore Brittany's attitude around changing this behaviour and moving on to alternative self-soothing strategies. And we'd also look at preventative approaches that could be used within the school context to help prevent Brittany becoming distressed to the level at which self-harm is engaged in. Moving on, another important area of the Adolescent Intervention Guide that I strongly recommend professionals have a look at is the relational approach to formulation. I think this is especially important in Brittany's case because of her experiences of trauma at the hands of attachment figures, which may have led her to develop an especially complex, damaged sense of self, in addition to attachment issues. The relational approach may help shed light on Brittany's challenges in her relationship with herself and her relationship with others. Building a secure relationship with Brittany may be challenging, as she may engage in push-pull behaviours and have significant trust issues. However, such relationships can be especially important for her recovery, and I would say that professionals should set themselves the goal of mindfully rising to this challenge. In particular, being deprived of secure relationships may make Brittany desperate to pull others in to meet this need. However, she may do so with behaviours that, without a proper formulation, would get mislabeled as attention-seeking or melodramatic, and they're in fact signs of her help-seeking and distress. Brittany has just been removed from her family through either her own choices or those of an external agency. Either way, she's experienced some major social losses and trauma. These losses may make peer relationships seem even more important and challenging to Brittany. She may be particularly vulnerable to perceived rejection or bullying from peers. Additionally, young people whose life experiences are significantly divergent from their peers can struggle to take the perspective of their peers and to understand the motivations behind the actions of those around them. Naturally, this confusion and inability to understand the actions and reactions of others can lead consumers to being very threat activated. They're not able to predict the behaviours of those around them, and thus they don't know how to predict what they need to do in order to keep themselves safe. In attempting to find strategies to work with young people's relational difficulties, I would draw attention to the psychotherapy section of the guide, discussing expressive and supportive techniques. In initially forming a relationship with Brittany, a great number of supportive techniques may be required. This supportive relationship may help build rapport with Brittany, but it can also be used to help repair Brittany's damaged relationship with herself by teaching her about her own strengths and positive qualities. However, it's really important that our relationship does not get stuck using only supportive techniques, and that once rapport has been established, we start using expressive techniques such as prompting Brittany to engage in perspective taking in order to promote her self-growth and skill building. Thank you.
That's wonderful, Esther. And so it really does emphasise the balance between us being supportive of where she's up to, but also really keeping in mind the idea of helping her to think about change as well. So we turn now to Heidi. Your perspectives on Brittany, please.
Thank you, everyone. I'm really pleased to be here. School counselling service staff play a really important role in supporting young people like Brittany, but I would like to acknowledge that in many school settings, particularly in rural and remote schools in New South Wales, the school counsellor or school psychologist may be the only mental health clinician working with a young person like Brittany. In every situation, the school counselling service has the capacity for meaningful psychological interventions with young people. In Brittany's case study, the initial purpose of the meeting is to gather the right people and the right information to support Brittany's return to school and to determine how this can be done effectively. In doing this, it is important to identify the key people who will be involved in this crisis. In some instances, a meeting like this may not be appropriate for everybody to attend. It might be quite intimidating for a young person like Brittany to have a team of people there when it's her first time back at school. So perhaps another way of determining how communication might be made important. In this case study, a risk assessment and safety plan were completed by the school counsellor, but also by the primary treating clinician prior to her return to school. The risk assessment by the clinician might have identified school-specific triggers for Brittany's distress, but school counsellors can also support schools to identify and manage risks to the school context. Some of these risks or triggers can be managed by a safety and support plan and a care plan. There are some really great examples of these plans in section 7 of the guide. Another really important purpose of the meeting is a plan to collaborate with the stakeholders so that a coordinated approach within the school and between all the other people involved in Brittany's care can take place. Thank you, Bryn. One of the beauties of the school counselling service is that it can be adapted not only to the needs of the young person but also to the school. In Brittany's case, it is likely that she will need ongoing care and support, but initially that support may need to be a bit more focused. I'd also like to reinforce the importance of continuing collaboration with the key stakeholders. This might occur through further meetings or when it depends on the school context and the context of the case. Brittany, in any case, needs to be at the centre of any planning that takes place. The school counselling service also plays a really important role in supporting teachers and peers and families who might be impacted by Brittany's suicide attempt. So the school counsellor may also need to guide the capacity of staff who might be affected by Brittany's behaviour when she's distressed. Another important step will be implementing care and safety plans. How and with whom do these plans need to be communicated? This, again, will be different in every context. Perhaps it will be just to class teachers. Will we need to communicate to this to the carers at her accommodation service, to her mother, who still seems to be somewhat involved in her support and care? The school counsellor will also be working therapeutically with the young person. Initially, the work may be on engagement or continuing the therapeutic relationship with Brittany. In any case, it will be important to focus on building trust as well as establishing therapeutic care goals. Some of these will be working with Brittany to identify her strengths and finding ways to increase Brittany's engagement with school and the wider community may provide a chance for her to feel a greater connection to herself and to others and provide routine and structure in her life. So one therapeutic goal might be keeping Brittany connected to school. Some things will be working in favour of that goal, for example, the network of support already available to her at school, and some things will be working against that goal, perhaps challenges in relationships, for example, with her mother, or potentially her unstable accommodation. In addition to providing ongoing care and therapeutic support to Brittany, the school counsellor or school psychologist can liaise with teachers and support staff to help Brittany engage with learning. As time goes by and the initial crisis has passed, the school counsellor may be working on providing ongoing care and support, working with Brittany on building medium-term skills and establishing medium-term collaborative goals. Brittany will still be at the centre of any of this planning, and there will be continued liaison with any primary treating clinician. The school counsellor can also look at providing whole school support for Brittany's educational attainment, as well as monitoring ongoing risk, her attendance, engagement, and also identifying with Brittany who is in her network of support in the school and connecting her with this network. Ideally, there should be a team approach to supporting Brittany. However, there may be barriers to this collaboration. For example, Brittany's concerns about privacy and confidentiality. Another medium-term goal, for example, might be helping Brittany to develop pro-social connections. So what is working in favour of these and what is working against? For example, we might be working with Brittany on appropriate use of social media. Perhaps a strengths-based approach might be used, and some strengths may have been identified in the initial care plan. The school counsellor can also coordinate with the school to provide a whole school support for her educational attainment. Thank you. A third phase in working with Brittany is supporting her after the current crisis has passed, and we are hopefully seeing her move forward in her life. It's probably likely that we can anticipate that there will be other crises for Brittany. So how can we facilitate ongoing liaison and continued connection with Brittany so that she will want to re-engage next time, hopefully before she becomes acutely unwell? So she will require ongoing support and monitoring. How this is managed depends on the context of the case and the context of the school. Brittany may work with the school counsellor to work out what her goals are for the future. Perhaps these goals might be around further study or work or more stable housing. So the school counsellor might assist Brittany to connect with other school staff, such as the careers advisor or learning and support teacher, to ensure ongoing support in the school context. There will still be ongoing communication with the mental health clinician, and another important step is post-crisis planning and ongoing self-care for Brittany, perhaps helping her to identify what the triggers were leading to the last crisis. Checking in with her regularly at school is going to really make an impact. There might be barriers for Brittany engaging in mental health support outside of the school context, for example, who will take her to appointments. So the beauty of the school counselling service, another beauty of the school counselling service, that we are available to her should she need to check in with somebody. Milton Erickson used to say to his patients, "My voice will go with you." His voice did. What he did not say was that our clients' voices also go with us. Their stories become a part of us, part of our daily lives and our nightly dreams. Not all stories are negative. Indeed, a good many are inspiring. The point is that they change us. It is a privilege to work with young people in the way that we do. I would like to acknowledge the good work done by all the mental health clinicians and school counsellors and school psychologists that work with young people like Brittany. In many cases, the school counsellor or school psychologist might be working with a number of young people with similar presentations as Brittany across more than one school context. In any case, whether you're working with 1 or 5 young people like Brittany, the work we do can be very demanding. It's so important to engage in supervision and also to practice self-care, just as we encourage our young people to do the same. Thank you for the work that you do, and thank you for allowing me the opportunity to speak with you.
That's wonderful, Heidi. Thank you so much. All right, so now we have the 3 experts who have provided some very important perspectives on the case of Brittany, both in terms of the systems issues, how we can think systemically and as a group, but also some of the real psychotherapy issues that we need to confront in terms of her challenges. We now move on to some panel reflections. So firstly, I'll just invite John to say, was there any other reflections that you had now that you've heard all of the presentations about what we can really do to help someone like Brittany?
I think, what I really like about the schooling role is that we get to work with some really great clinicians, both in schools and in mental health services. So really, our role is to support that, make sure that people have the information they need to make the right decisions, and be there as a bit of a backup, really. So I think that's the one reflection that I have. Yeah.
Esther, what's your sense of it?
Yeah, I really liked hearing what other people had to say. I think John and Heidi both made very good points. One that John made that stood out to me was about the need for social connectedness for Brittany. And I think that the school community is likely to be a very important relationship in her life, because they can serve as a source of stability, which is really important given the instability in her home life and the fact that her sense of belonging to her family has been disrupted, and that's going to heighten her need for a sense of belonging within the school and wider community. So school staff and counsellors are in a unique position to promote stability and safety for her, given the number of hours they see her and the long-term presence they form in her life. So that school environment is going to really play a role in her emotional regulation and functioning. And the people in the school are a very big part of that. So strong relationships within that context could go a very long way towards supporting her academic and emotional well-being. And I'll make just a brief reflection on Heidi's talk as well. She mentioned helping people identify what Brittany's triggers are. I just wanted to say that with adolescents with complex trauma and adolescents as complex as Brittany, they themselves can really struggle to identify their own triggers and patterns of escalation. They've often learned to ignore and avoid thinking about their own distress. And for this reason, it's really important for school staff, such as school counsellors and other adults, to set themselves up to be a useful tool in teaching that young person how to check in with themselves and develop emotional self-awareness. So I thought it was really great that Heidi was talking about other people helping identify those triggers for Brittany and sharing that knowledge.
So Heidi, that really does put the responsibility back on the school counsellor for many of these really important treatment goals. So it's over to you as our school counsellor on the panel.
Thank you. I do think it works best when everyone is working together and we're collaborating though. So we're lucky in schools, we have a built-in network of support. We don't work in isolation in most cases. We have principals and year advisors and career advisors, all that can provide that support for Brittany when she's at school. So we are in the unique position that we can call upon our teaching colleagues and all of our mental health colleagues to help vulnerable young people like Brittany.
And I think one of the issues really is the opportunity for us to reach out and try and make sure that we have supports both within the school and outside the school to really collaborate on getting the best outcome for such a vulnerable young person. All right, so I'm just now getting a whole lot of questions that are coming in from our audience. And so, John, I have a question for you. The first question is, what do you suggest when there's limited access to local services?
Can be a real challenge, Bruna, in rural and remote communities. So I think, first of all, just as Heidi and Esther have been saying, we should do the best we can to work together with what we have, so we don't feel isolated with this. And I guess too that these days the reality is that services have regional focuses, and therefore they may not be available on the ground, but they do have responsibilities in even quite remote places. And there are opportunities now with technology to link them in so they're part of the complex planning, and we can identify exactly what it is that they may be able to do to help us. There's also, I guess, as we move along a little bit with someone like Brittany, there may be other services that can provide counselling and so forth that may not be able to be there in person, but do provide services via web-based services and video link services, telehealth and so forth. So Headspace would be a good example of that. But also I know Royal Far West is providing services, even school counselling services in some places. And I know in Murrumbidgee there has been some school counselling provided from central locations to more remote schools. So even in Murrumbidgee, and I know in other districts, our emergency mental health services provide services to local hospitals via video links. So there are a lot of services that technology has now I suppose, enabled us to include in a service response to someone like Brittany.
Video conferencing and telehealth are really not only supporting staff to get the right support, but also direct client contact as well, and getting right into families and helping to really do assessments and provide the support when remote and rural areas can't necessarily access a service down the road.
Yep.
All right, there's another question, Esther. This one's, I think, is for you. It's quite a complicated question. Residential care is associated with low school engagement and low school achievement in some ways. How do we think we can help Brittany to make sure that that doesn't happen?
So I think in order to try and answer that question, I would say that whoever's trying to answer it, because it's going to need to be answered multiple times on a case-by-case basis, we need to think about why that association exists. Why is it that residential care is resulting in low attendance and low achievement? For example, is it because of a lack of transport? Is it because of a lack of parental figures at home who are assisting with homework or with motivation to attend school? Is it because individuals living in residential care have more complex needs? So I'd say we need to explore it on a case-by-case basis, because it's not always going to be the same answer. And we need to know why that association is there before we can start engaging in appropriate problem solving. I'd say that working collaboratively with the external accommodation providers is likely to be a really important step in addressing this, because they may have a role in all parts of that equation. They may have a role in being able to help set up assisted transport for Brittany. They may have a role in acting as a replacement parental figure to help her with homework, or perhaps the school might have a homework centre or some other facility they can set up. And they also may have a role in getting a really good insight into what exactly is going on in that young person's life. Because if there's a whole lot of trauma going on within their residential care environment, if they're living with other young people with complex needs, perhaps what's going on behind the scenes before they get to school needs to be addressed. And that could be through a private psychologist or CAMS working with that residential care team to come up with some problem solving around that, and to give Brittany some self-soothing strategies if it is the case that she's getting too stressed before the day even begins to get to school. So it's not a simple answer, because that's often the case with these complex cases. It's a case-by-case basis, but rather than just trying to jump in with a solution, trying to talk to Brittany and others in her life about the why before we answer the how do we fix this, is what I'd want to encourage people to do.
Yeah, so that's great. So it's really a balancing act here, isn't it? We want to both engage Brittany's own agency around getting to school on time and whatever she can do to get out of the residential place on time, but at the same time collaboratively work with the unit itself and with the staff that are supporting her to make sure that they're also doing everything they can as well. And trying to understand it, really try to understand the issue. And as you say, what is the why? Yeah.
Yeah, I think especially because it's often very easy to assume it is the young person that is at fault. But if you put any of us in a really challenging situation, many of us are going to fall down some of the time. And so assuming that it's Brittany being difficult or lacking in motivation is a dangerous road to go down. And that could be the answer to the why, but make sure that you have established that rather than jumped to that conclusion.
That's come in, Heidi, and I'm sure that you'll enjoy this one. This is really about, we need teachers to be on board. And I guess the question really is, how would you approach teachers and how would you get them on board? And what sort of information do you think teachers need to help understand and support Brittany as well and be part of the team?
I think it depends on each case. In Brittany's case, she already has a number of teachers who are concerned, who've raised concerns with the counselling staff and with their year advisors. So the job's half done for us. But a lot of young people are really quite prickly and will push away any support, and often they exhibit externalising behaviours as well, and it's quite easy for them to get teachers offside. I'd argue that not everybody needs to know about what's going on for Brittany, just those teachers that are really working with her, and it also depends on her behaviour. If the young person is somebody who is self-harming at school, then clearly more people are going to need to know to make sure that she's safe. If she's absconding and that means that she might go and hurt herself, then again, people need to know so that we can really closely monitor her if she's not showing up to class. But in all of these situations, it's something that's going to be a collaboration with Brittany about what she's willing to share and about what people really need to know, because they don't need to know everything. And we're in the business of looking after the wellbeing of young people. So that's part of our job, working in schools.
So it really is a bit of a balancing act, really, isn't it, about how do we give them enough information to be helpful, but at the same time, respect Brittany's privacy and how the other kinds of issues that she might, so she can feel confident enough to talk about confidential issues and so forth.
Yeah, that's right.
All right, thank you. So this is a tricky one for you, John, and I'm interested to hear your response. And I think it's particularly useful in terms of the role of the School Link coordinator. So we have had students in the past who do not want the school to be involved. They do not want the psychologist to collaborate with the school counsellor. What can we do in those situations?
And it is difficult, Bryn, but really the approach that we're recommending relies on relationships. So the relationship doesn't have to necessarily start with a particular counsellor or whoever. It can start with any staff member who can build a rapport with that young person and support them along the journey. And that's just about being willing to listen, be non-judgmental, as we say, listen to the story, and support that young person to then engage with perhaps the local school counsellor and gradually move towards a more collaborative approach. That would be my suggestion.
We really have to start somewhere. I guess that's the main thing, is we do what we can and just take it from there.
Yes, often we're exploring who it is that just has some connection to that young person. And it may be the art teacher, it may be someone who's been involved in drama with them. It could be, someone quite different to what you might expect, but usually a young person, and this young person has had some positive experiences of school. So there will be someone in the school environment that she has connected to more significantly in the past.
Thank you. We move on to another question. I think this one's for you, Esther. As we saw, Brittany really is quite helpless and hopeless and really feeling like others don't care and they're just judging her. What do you think some of the strategies we can use to support her, to promote her to feel a bit more of a sense of empowerment and a bit more sense of agency in her own recovery?
So I think the first step towards empowering somebody and giving them agency is actually by empowering them and giving them agency. That sounds funny, but what I mean is the very act of giving them choices and asking their opinion and making sure that you do so in a context that enables them to answer. So what I mean by that is that gigantic school meetings with 10 staff members and 5 family members, I'm exaggerating of course, are often not the context where that young person feels safe enough to be able to actually act on their own agency. So knowing them and being able to read them well enough to know what you need to set up to have them be safe so that you can then have a conversation with them when they're in their green zone or their brain switched on zone and give them those choices at that time. And also with highly traumatised individuals and anybody who's got a severe mental health condition, it's often the case that it's very easy to overload them. And so asking really open-ended questions whilst it's really lovely and it's warm and embracing, it can sometimes cause them to freeze, and schools and other people around them can think they're just really difficult or really disconnected. In fact, they're really overwhelmed and their brain can't filter through the amount of information that's racing through it and can't filter through the background noise of their own anxiety. So if you come across a young person like that, giving them just 1 or 2 options is still much better than just making the choices for them. The other thing in terms of building up her sense of agency and connectedness is people building secure rapport relationships with her, because she's got this massive trust issue. It's going to cause her to feel very unsafe and be much more likely to have her brain switch off and be unable to participate. So if you can have school teachers, school counsellors, camp staff, anybody and everybody that meets her be trying to build rapport with her through listening and taking the time to hear her, through following the supportive techniques that are listed in the Adolescent Intervention Guide, and there's quite a number of them listed there, then that rapport is also going to build her sense of self-esteem within herself, and it's going to build her safety, which will enable her to act on her own agency as well.
Some very important strategies there to help her regain a sense of agency, and we often talk about the curious stance of the therapist sitting next to the young person and asking questions like, well, what do you think is the answer to this? What do you think is going on for this person? What problems, how do you think you might be able to solve them? And actually putting it back on the young person to try and stimulate, if possible, some of their own capacity to solve their own problems.
I think also with that, another thing I didn't mention, part of the reason I mentioned reflective practice at the start, be mindful of your own reactions to that young person and your own judgments, because they are often, these traumatised young people are often very on alert for threat and for feeling judged. Brittany's talked about how she feels judged by others. They may not mean for her to feel like that, but if there's some part of you that does have a bit of a, I don't really like this young person, they're difficult, or I'm feeling threatened by being around them and their behaviours because they're unsafe and I don't know how to keep them safe. If that kind of stuff is going on inside you and you're not dealing with it within supervision or by getting appropriate support, it's entirely possible that that young person will pick up on some of that in the room through your body language. And they won't know what to attribute it to and are highly likely to perceive it as rejection of them. So that would be the other thing I would say when you're trying to work with a young person with personality disorder or complex trauma. Be very, very careful of what you are doing. Don't just pay close attention to them, pay close attention to your own reactions and your own emotions in that room.
Yeah, and that really does, I guess, really underlie the core principle, as the manual talks about, of making sure you have your own support and your own peer consultation to really ensure that you get the help that you need to remain as objective as possible and optimistic and compassionate, and to really prevent that young person getting under our skin and making it more challenging.
And I think that curious stance you mentioned can help with that. That curious stance also isn't placing yourself as an expert, which no matter what your level of experience is, most people like to be talked to on the same level that they're at. They don't like to have somebody coming in imposing a whole lot on them. And being able to not put yourself in the position of an expert is likely to make you feel more relaxed. You can just be curious, and if Brittany says something or asks something that you don't know the answer to, you can just acknowledge that, and it humanises you and potentially helps her build a connection with you.
We've got another question coming in here, and so Brittany's in the second last year before school finishes, so she's facing end of year exams and preparing for her final exams. Often young people with complex mental health issues miss a lot of school, and they can miss a lot of assessments as well. So Heidi, I think that you might be able to provide some guidance here about, when there are minimum attendance requirements and it's very challenging, how do we help them, like people like Brittany, through all of that process?
Those N awards that come in when Year 11s are doing their preliminary exams and Year 12s are doing their HSE are really stressful when they're coming to young people who have complex mental health presentations. The ones that they get for attendance, unfortunately, come at a certain percentage of time that they're away, but ultimately it is the discretion of the principal as to whether a student can get through the HSC or not. In most cases, they do need to demonstrate that they understand the course content, and again, it's on a case-by-case basis. But I do acknowledge that it's also keeps things on an even playing field for those young people who are attending and giving their all. And they're well enough to do so. A lot of young people also have the opportunity to do their HSC by pathways, which means that you can take a little bit longer and you can still achieve an ATAR for subjects. So there are all sorts of options available to young people who aren't well at that particular point in time to access their education in a different way. But again, it's all on a case-by-case basis. Did I answer the question?
Terrific. So really, we do need to look at options, and we need to slow it down a little and not get too reactive about the fact that her peer group might be facing exams, but maybe there's a better way of approaching it so that Brittany can do it in a fair and reasonable way that's going to help her the best. All right, John, I have a question for you. It looks like there's sometimes some tension here, and we're talking about how sometimes school principals, can make some tough calls around whether or not they feel or the school feels it's safe enough for somebody like Brittany to come back to school. What do you think? What's your advice and what's your thinking about cases where the school feels as though the student's too unsafe to return?
Well, again, it comes back to collaboration, Bryn, and I quite recognise the responsibility that principals have to not only keep their individual students safe, but the rest of the students in the school as well. And it can be quite traumatising for students to see a young person going through significant stress and self-harming, etc. So they have to weigh up those priorities, I guess. So it's really important for us to sit down and look at the safety factors and make sure we have a good plan in place. I think related to some of the earlier questions as well, having goals and helping a young person recognise what it is they want to achieve in the short term at least is part of building that rapport. So if you have some agreed goals and you can sort of look at how they relate to safety at school, etc., you're much more likely to be able to come up with a plan that the school feels secure with. And if the school knows that the mental health services involved, the school council is aware and involved, then they will feel more secure about having the young person at school. So it again is about clear and open communication, everybody knowing what their role is, and the young person being involved and part of the process of developing goals that relate to her safety as well.
Answer then was, we shouldn't just helplessly roll over and say, oh, well, the school doesn't want them back and therefore there's nothing we can do. I think there's actually a lot we can do, which is a lot of it's about collaboration with the young person and really showing and demonstrating a pathway back to school that everyone can get on board with.
Yes, it's about often these situations is about bringing down people's anxiety around the young person, really, because that anxiety can actually escalate things for the young person. So, we're talking before about how we help the staff to feel more confident around the young person, and I think the Project AIR Schools program can help with that. We can do staff-in services about how to respond to young people in this situation. So if the whole staff feels more confident, the young person's going to be more confident and safe in the environment, and the school will feel more confident about having them there.
Nice. That's really terrific. All right, another question's just come in, and Esther, I think this one is for you. And I think in terms of somebody like Brittany and the complexity of her case, we often sometimes find that Brittany can lurch, I suppose, from one crisis to another. And sometimes we can be pulled into trying to manage each of the crises that she presents with. And how can you balance that, I suppose, with trying to keep on track with really the opportunities for clinical and therapeutic work, and making sure that we don't get continuously sidetracked, I suppose, by the next crisis that comes along? Any hints or strategies on that one?
Great question, especially because it definitely is a very real issue that comes up. Certainly I've had lots of young people who every week or even every second day there's a new crisis, and sometimes those crises are continually really huge. So they're not minor, trivial things. Sometimes there's a lot of chaos in their lives. So I would say in terms of that balancing act, part of that balance and what percentage you're going to spend on both depends on what your role is. Within CAMS, I do consider it to be part of my role to be trying to keep the young person safe. So I am going to respond to the crises. But I also see it as part of my role to be progressing them and not having them attending CAMS for the rest of their lives, or until they are too old to attend anymore and then they're stuck with less support services as an adult. So I would say that initially I would deal with the crises because I'd still be forming a relationship with that young person and their family. And I wouldn't be in a position to say to them, hey guys, this is a pattern. But once I had actually developed a relationship with them, I would actually draw their attention to that pattern, and I would say to them, okay, so I don't want to just keep going from one crisis to another. Can we come up with some sort of compromise, like spending the first half of every session dealing with whatever the crisis is that week, because it's something that really needs to be dealt with, and that you're not going to be able to attend to anything else I say if you're really threat activated, because whatever that crisis is running through your head. But then spending the second half of the session, we agree that we will stop talking about that crisis, and you will know up front we're only going to have X amount of minutes on that. In the second half, we're going to try and build some skills and potentially use the crisis to build those skills, as in cater the session to what skills were lacking that led to the current crisis. How could the crisis have been averted or handled better by that family or young person? So crises can provide really fantastic opportunities for learning a lot of the time. once you've got the rapport to be able to be that direct, I would say that that would be potentially really hurtful if you didn't have that rapport. If you just said to them, you're in crisis every week, it's not going to come across very well. But once you've shown them that you're there to help and you've done that for a few weeks and you feel like you've got that rapport, they're going to be more open to hearing from you that you want to move on from just that. And in schools, it may not be their role to deal with the crises. It may be their role to go, okay, who else do we need to involve? Do we need to call CAMS and tell them this young person's come in today like X? Or do we need to call their parent? Does their parent not know that this young person's in crisis? So what you're doing to do that balancing act does depend on who you are. It's not the same answer for everybody. But I would also say it is incredibly frustrating working with that. You can feel really stuck, but I have never yet had a case where it hasn't eventually succeeded in progressing to getting to spend more time on building skills and that family having their crises reduce in frequency. So engaging in that self-care that Heidi talked about, so that if it is providing a challenge for you because you're feeling frustrated that progress is slow because you're only able to spend half an hour a week or half an hour a fortnight on skills, learning to sit with that and be accepting of that in yourself and have some self-compassion to manage whatever that brings up for you, and having the ability to talk to other professionals about it, and hopefully they will be able to give you the confidence that yes, this will eventually start to unravel and start to sort itself out in a productive manner if you persist, because that has been my experience.
Yeah, that's lovely. And look, I guess one of the issues really is also, it comes back to that core psychotherapy skill that we kind of have to talk to the emotion first before we can talk to the thoughts or the cognitions. And if for someone like Brittany comes in very emotionally dysregulated, we might have to spend some time in helping her with her emotions first and really helping her to feel more regulated before we start to try and move to helping her to be more curious about solving some of her problems as well. And obviously it's a skill to do, how to get that to happen as quickly as possible in sessions so that the young person can feel ready to do some work about the future and kind of putting in place some of the strategies and skills that are going to help them to do better. Can be really one of the timing issues and one of the difficulties with it as complex as Brittany.
Yeah, definitely. That co-regulation that often young people who've got a difficult parenting history or a trauma history, they may never have experienced as small children, toddlers and adolescents, another adult in their life being there with them in their distress and helping them learn to regulate it. So sometimes we are actually playing quite a reparative role in undoing something that's been missing for them for a really long time. And it is, I think, something that I have seen as a mistake that has been made some of the time when, especially within schools, when they're resource poor and they've got a lot of challenging young people, if they do try and jump too quickly from the emotional regulation to the skills and they don't actually help contain that young person's emotions, that young person can end up feeling very rejected by them and can end up not wanting their help at all, and acting in potentially aggressive ways towards that staff member or individual. So yes, that role of first acting as an emotional container or aid is really important.
Thank you, that's terrific. All right, we're coming to the end of our webinar, and it's been wonderful to have all of these different perspectives. I will just invite each of the three panel members just to say one brief reflection before we finish. I might start with you, John. Do you have anything else that, after thinking about this whole case of Brittany, that you'd like to kind of add?
I guess really to remember where Brittany's come from, and it's not all about the negative things. She's actually achieved quite a lot up to this point. So there's lots to fall back on to help her progress.
It's really important. Esther, do you have any final reflections?
I said right at the start of my talk about the fact that we need to have a complex formulation for a complex case. So we need to think about the biopsychosocial elements, all of them, and the guide can help people in unpacking them. Because, yeah, as John said, there's always going to be positives, and we need to remember to draw on strengths, and we need to look at the young person's history, because a lot of their behaviours are learned behaviours that were highly functional at some point in that young person's life. And understanding why they're behaving the way they are really helps with understanding how to change it, and also with us tolerating it and being able to sit with it for a little while whilst we work towards that change. So in Brittany's case, I'd say that she talks a lot about feeling like nobody understands her. So taking the time to try and understand, and also being aware that she may have a pretty negative relationship with herself. She's faced a lot of rejection from others and this complex relationship with her mother. And that may mean that it might be quite uncomfortable for her to actually have care providers being nice and trying to build relationships with her. So just being a little bit reflective about what's going to happen when you try these different approaches. What are we expecting from her? Because not all young people are going to respond well to warm, fuzzy approaches. And being able to know in advance how we think they're going to react helps us plan for that as well.
Nice. Thank you. All right, Heidi, you get the final say on the case of Brittany.
Thank you. I'm very grateful for that. It is just so important when we work together. Not just within the mental health services, but also within our schools. As I was saying before, we do have a network of support built in for young people in schools, but we also have school counsellors and school psychologists can forge ties with other people in our networks beyond schools as well. We're in a really unique position to be able to do that for the young people that we work with. The guide is a really important and really useful tool as part of our repertoire. There's some great stuff in here that lots of people will find really useful. I think it's available on the website too, is that not right? On the Project AIR website. So I know that school counsellors and school psychologists will have this made available to them as well. But there's some great stuff in there that will be really helpful. It's been a great experience working with Project AIR, and I know that people who've done the training already are really appreciative and have really found that they've gained a lot of really good skills out of doing the work and working with the guide. Thank you.
And look, on behalf of everyone, I'd really like to thank you all for joining this webinar. I think it's been a really wonderful and deep and rich discussion of the case of Brittany, but also a really nice perspective on different ways of thinking about this case, and really also guiding, I suppose, us to the Adolescent Intervention Guide for Clinicians. That is available on the Project AIR strategy website, www.projectairstrategy.org. And we would encourage you to use that as the key resource for preparing you for working with young people like Brittany, and also for really expanding, I suppose, the options that we have to really work in a collaborative way. Thank you so much for joining the webinar. Good night.